It's one of the major causes of blindness, kidney disease, heart attack, stroke, and lower limb amputations. Chances to die because of this disease will be doubled in 2040. Ladies and gentlemen, please welcome diabetes.
We will now go to our third lecture, still with hormones, metabolism, and the balance within. Now, the topic is on obesity, metabolic syndrome, diabetes, and regenerative medicine for survival. Our speaker is an intensive and critical care practitioner, former dean of postgraduate education, founder of the Journal of Emergency Medicine and Journal of Clinical and Laboratory Medicine, and 2007 winner of a scientific grant by the European Society of Intensive Care Medicine. He is currently the senior medical advisor at the European Wellness International in Germany, a lecturer at the European Wellness Academy, and head of the Department of Anti-Aging at New Elements, Shenzhen, China. With PhDs in clinical medicine, as well as anesthesiology and intensive care, and decades of experience in the field, he has been invited as a speaker and moderator in over 90 lectures across the globe. His findings in cell therapy, cell membrane disorders, and regenerative medicine have led to successful treatment of patients across Europe, Asia Pacific, and the United States. Ladies and gentlemen, let's all welcome Dr. Yuriy Nalapko.
Hello, everyone. Did you know that 420 million people worldwide have this disease? It's one of the leading diseases worldwide and is one of the leading causes of death. It's one of the major causes of blindness, kidney disease, heart attack, stroke, and lower limb amputations. Our chances to die because of this disease will be doubled in 2040. It can be treated with diet, physical activity, and only on the third place with medication. Ladies and gentlemen, please welcome diabetes. My name is Dr. Yuriy Nalapko, and today I want to speak about how to prevent diabetes and how to survive with the diabetes. So, diabetes is only stage 3 of such diseases like obesity, metabolic syndrome, and diabetes. So this is my disclaimer. This presentation is only for educational purposes, and in any case, in any particular medical case, please refer to your physician and ask him or her how to treat each particular medical case. And I declare that is the absence of the conflict of any interests. So obesity has a lot of paradoxes. For example, 40% of the world population are overweight. And obesity is considered as a cosmetic problem, but in fact, it's absolutely wrong position. This is a medical condition, and this is disease, severe disease. Majority of obese persons dream about the weight loss and do nothing. People with normal body weight, rather than overweight persons, want to lose the weight. Unfortunately, obesity is tremendously disseminating among the children and teenagers. So it's not only aesthetic defect, but huge medical problem. Please bear in mind that obesity, it's not the disease of our body, but also this is the disease of our mental health, of our brain, of our mental kind of thinking. So obesity causes depression, and depression causes obesity. So that's why if you want to treat obesity as a precondition for diabetes, we have to treat our brain, our mindfulness also. There are some predisposing factors, risk factors. First of all, it's overeating and our genotype and passive lifestyle and high insulin concentration in our blood, and also some diseases like hyperthyroidism. But as you can see, the majority of such risk factors belong to overeating. There are many causes which can cause obesity, but the majority of obesities caused by our elementary overeating. For a long time, body mass index was a very good indicator for obesity diagnosis. And according to the World Health Organization, there are a lot of stages of overweight and obesity. And what is the interesting that risk of complication increases with increasing of body mass index. So body mass index, it's not only indicator of our aesthetic, how can we look like, but also the risk of complication from the side of the cardiovascular or liver or any other systems of our body. Unfortunately, body mass index doesn't work well always. In some situations, we can make some mistakes based on BMI, so that's why BMI doesn't work well at all always. So that's why we have two types of the fat depositions. It looks like visceral or apple-shaped obesity and subcutaneous or pear-shaped obesity. What is more interesting that apple-shaped obesity is associated with metabolic syndrome and diabetes. So these two types of the fat depositions are different by morphology, brown adipose tissue and white adipose tissue. And also, brown and white adipose tissues have different functions. What is most interesting in functional differences that visceral or abdominal obesity accompanies by pro-diabetic effect, and all these types of obesity can demonstrate the endocrine activity of the fats. That's why fat is one of the endocrine organs. Fat can stimulate some and synthesize some different hormones like leptin, estrogens, pro-inflammatory hormones, and so on and so forth. So that's why obesity can cause severe diseases. What is metabolic syndrome? If we lose the obesity stage, our patient can get metabolic syndrome. It's only one step to diabetes. So what is metabolic syndrome? We know for a long time that overeating can cause obesity, obesity can cause morbid obesity, and during the morbid obesity, bad fatty acids stimulate high triglycerides, high low-density lipids, and a low concentration of high-density lipids. And altogether, these three factors can stimulate erythematous dyslipidemia and cause atherosclerosis. So this is the old story how atherosclerosis occur. But what is new fact that morbid obesity can demonstrate high glucose level in our blood, and high glucose causes high insulin, and which causes water and sodium retention, vasospasm, stimulation and proliferation of smooth muscle tissue, and insulin resistance. All these factors can stimulate arterial hypertension and complications like heart attack or brain stroke, and insulin resistance can cause diabetes type 2. Moreover, morbid obesity leads to high waist circumference. All these four factors, all these four signs and symptoms can lead to metabolic syndrome. So metabolic syndrome is a combination of such four factors. But unfortunately, it's not only atherosclerosis, hypertension, and diabetes. there is the long list of the complications of metabolic syndrome. And obesity can cause metabolic syndrome, and metabolic syndrome can cause these long list of complications. If we look closely to this list, we understand that metabolic syndrome is the model of the aging, or accelerated model of aging. If we have metabolic syndrome, we become older soon and faster. Some criteria given by World Health Organization and some international and American organizations. But what we should remember that different races, different ethnic groups have different waist circumference cut points. If we are talking about, for example, Asians, like Filipinos or Chinese or Malay, as well as Japanese and Chinese, we have to have waist circumference less than 90 centimeters for males and less than 80 centimeters for females. If this waist circumference is larger, it means that we have risk factor of the metabolic syndrome. To put this diagnosis, we have to have at least 3 components: abdominal obesity and either high triglycerides, either high blood pressure, either high density lipids, or insulin resistance or high glucose. So this is one step to diabetes. How to prevent or how to stop, how to reverse metabolic syndrome? Fortunately, at this stage, we don't need a very severe or expensive medication. We have to change our lifestyle, adequate diet, the physical activities should be kept on the high level, psychological and social support, and only on the next stage is drug and surgery therapy. So what lifestyle includes? Stop smoking, weight control, very good night sleep by length and quality of night sleep, stress-free lifestyle, and we have to lose the weight very slowly. For example, 2 kg per week, not faster. Talking about the diet, our daily calorie restriction is very tremendous, very important. We have to our foods should contain mainly hard digestible or indigestible carbohydrates. Don't use a lot of sugars or rice or sweets or honeys and so on, watermelons and so on and so on. In drinks, we should use sugar-free coffee and tea and vegetable juices, but not sweetie fruit juices. Low-calorie foods like vegetables should be increased. Unfortunately, according to National Institutes of Health investigation, 95, almost all patients who suffered from obesity, who have lost weight through diet therapy, return to initial weight in 5 years. So that's why only diet is not enough. We have to keep high level of physical activities. For example, we have to do at least 20 minutes intensive exercises daily or 60 minutes moderate exercises daily. In this case, we can lose 2 to 3 kg per week very effectively. In case of the ineffectiveness of such treatment, we can use drug therapy or even surgery. Even 10% of body weight loss gives a very good reduction of the overall mortality or diabetes-related mortality, improves our blood pressure, the sensitivity of our insulin receptors to glucose, and improves our lipid profile. What is most important, how to treat metabolic syndrome or how to treat diabetes if our patient has it already? Our experience is based on the treatment in European Wellness Metabolic Disorders Center, where we treat obesity patients, metabolic syndrome patients, and a lot of diabetic patients. We have very long list of the treatment and our therapy is very long lived, has very long length. So we have precursor stem cells, frozen cryogenic stem cells, peptides, mitochondrial organelles, and nano-organopeptides. So how we use these supplements and these approaches of the treatment? We can use combination of mitochondrial organelles and nano-organopeptides, which works on the cellular level and improves and restores the function of the deteriorated organs like diabetic complications like nephropathy, neuropathy, or retinopathy. And also, this treatment is very effective for patients who suffer of andropause or menopause. So precursor stem cells are effective for the potent first-line therapeutic rejuvenation and revitalization of the severely damaged organs by metabolic syndrome. Mitochondrial organelles application of organ-specific mitochondrial organelles peptides improves three major mitochondrial functions like apoptosis, metabolism, and oxidative stress. Finally, nano-organopeptides, which we use for almost all patients in our medical center, European Wellness International Medical Center. Nano-organopeptides are effective approach for the long-term restoration of the functions of impaired organs. And also, for sure, we use the combinations of such approaches. So that's why stem cell therapy or mitochondrial organelles or nano-organopeptides therapy to be safe and promising solution for metabolic syndrome and diabetic patients. This organ-specific therapy is absolutely safe and it is certified in the European Union. All inactive and inert ingredients are removed and no chemicals added, so we have all the certificates of the safety and efficacy of such products. As I said, the list of these organ-specific mitochondrial organelles is very long, so that's why in any particular case we can choose that organs we can treat more and more. Of course, we have to keep in mind not only nano-organopeptides which are inside of cells or organ-specific treatment, but also we have to remember about membranes of all cells, human cells. So for this purpose, we use for the restoration of the cell membranes, phospholipids, we use flux forte treatment, which can give very good effect for our cell membranes. So, three most important slides in my presentation. This is obesity protocol. This is our secret obesity treatment protocol. We recommend to improve lifestyle, to give good diet, to improve physical activity and keep it on the high level. Vegetal placenta EVA soft gels and combination of liver, placenta, and hypothalamus, pituitary, adrenal cortex axis, mitochondrial organelles, and nano-organopeptides, and of course, flux soft gels. As I said, the regulation of obesity is based on hormonal level, so that's why usually we give this combination of the organ-specific treatment: brain, hypothalamus, pituitary gland, and adrenal cortex. The second secret slide in my presentation is metabolic syndrome medical protocol. For these patients, we use precursor stem cell therapy, liver, placenta, pancreas, stomach, intestinal mucosa, kidneys, and eye. As you remember, these organs are deteriorated first in case of the metabolic syndrome, and mitochondrial organelles for the same organs. Flux infusions are very effective on this stage of disease. Also, we use vegetal placenta evolution soft gels, good lifestyle, and appropriate diet. Finally, for the diabetic patients, our secret medical protocol includes Precursor stem cells for liver, pancreas, placenta, stomach, intestinal mucous, kidney, and eye, as well as for brain, hypothalamus, pituitary gland, and adrenal cortex, as well as long-term mitochondrial organelles treatment. And also we use flux infusions, lifestyle, diet, and medication. Also, we can treat some other diseases which are accompanying these severe diagnosis. Of course, we didn't talk about diabetes type 1, but we remember that diabetes type 1 is one of the different diseases. So it's autoimmune disease. And nevertheless, we have very effective approach how to treat autoimmune diseases like diabetes type 1. In conclusions, metabolic syndrome accelerates aging, and diabetes is one of the complications of the metabolic syndrome. To treat this or prevent this situation, we have to keep the healthy lifestyle and to start this treatment immediately. Healthy diet is very important in the treatment of such patients. We have to keep the high level of physical activities, and we have to initiate this quit smoking of our patients. To hack the insulin resistance, we have very good combination of bioactive supplements like vitamin D3 and K2 complex, flax soft gels, and placenta evolution. This treatment is very effective not only for metabolic syndrome, but for diabetes type 2 also. The complications of diabetes type 2 occur early, and the stem cell therapy or cell-based therapy like precursor stem cells, as well as mitochondrial organelles and nano-organopeptides is very effective approach and gives us the possibilities to survive with this tremendous disease. I wish you best health. Thank you very much for your attention. And if you have any questions, please feel free to contact with us, and we will be happy to discuss any particular medical case. Thank you.
Yeah, thank you very much, Doctor, for that very absolute and apt lecture. Very significant at that.